Dr. Filipe, I had my cataract surgery, but my vision isn't good. What's going on? Can you help me? Can I help you? In this video, I'm going to give you the 5 most common reasons why this might be happening, why your vision isn't perfect 100% after cataract surgery. I'll explain these reasons from the simplest to the most complex. And my name is Filipe Lucatto. I'm always here on the channel, Dr. Filipe Lucatto, both on YouTube and Instagram, talking about cataract surgeries and retina surgeries. So share, follow the channel, and send these videos to people who might be interested in these topics. And today I'm going to address this issue, which is super common. It's a very frequent complaint, both in my office with patients who come to me saying their vision isn't 100%, even after having cataract surgery, as well as in teleconsultations. Sometimes patients have a report, have their test results, but they're not completely sure and seek information remotely about what's going on with their eye. All right, let's get started. As I mentioned, there are causes that are easy to resolve when it comes to this. But there are also more complex causes, and I'll explain them. The first reason why your vision might not be good after cataract surgery basically is a lack of patience. Calm down. If you just had the surgery, if you're in your first week, you might have that expectation of, I had surgery yesterday, I already want my vision to be 100%, but it's not quite like that. Cataract surgery is very safe and recovery tends to be quick. It's not a very complex post-operative period. And there really are some patients who have surgery one day and the next day they're reading everything. But it can also take some time, okay? Swelling in the cornea. The cornea is like the glass on a watch. So with the energy we use to remove the cataract, depending on the severity of the cataract, there may be a bit of swelling in the first few days, in the first week, which interferes with the way vision reaches the back of the eye. An intraocular lens is a new way of seeing. It's a new form of vision, so there's neuroadaptation. The brain takes a little while to adjust to this new way of seeing. And in addition, there are other situations. There can be macular edema. In some cases, swelling occurs in the macula. After cataract surgery, there can be some residual refractive error. We have an exam called biometry that calculates this. What is the lens power that I need to put in your eye to achieve the result I want? But this exam isn't always that precise, right? People who have keratoconus, people with high myopia, people who have had laser surgery for myopia in the past, their biometry isn't as accurate as it is in a normal eye. So there might still be a little bit of astigmatism left or a degree of myopia or hyperopia remaining. And besides that, the prescription doesn't stabilize right away. That's why we usually wait 30 days after the surgery on the second eye before prescribing glasses, when we need to prescribe them after cataract surgery. It takes a little while for the prescription to stabilize, so lack of patience is a common cause. The person is already anxious, had surgery this week, and already wants perfect vision. 100% sometimes they've only had one eye operated on. So the effect of cataract surgery is better when we operate on the second eye and balance the prescription, balance the way of seeing. So take it easy. If you're in this situation where your vision isn't that good, but you just had surgery, be a little patient, okay? This can get better and it should improve as you continue your follow-up. The doctor has already done their part. Now it's your turn to do your part by using the eye drops properly so you can have a good recovery and good visual function. Even if that means, for example, wearing glasses for distance, using reading glasses, or wearing multifocals, it depends on the type of lens you chose. All right, so let's move on to the second reason. The second reason your vision might not be so good after cataract surgery is a lack of preoperative alignment. Sometimes it's a lack of communication or even just a lack of understanding, okay? Sometimes the conversation did happen. The doctor communicated and explained everything that was planned for your surgery. But sometimes we have trouble understanding it all. That's why I make these videos here. I believe information is important. I'll leave a link here to a video, for example, that I recorded explaining the different types of intraocular lenses. Why am I saying this? Because sometimes the patient decided not to invest in a special lens. For cataract surgery, they chose to get the monofocal lens, the one covered by insurance. They didn't want to spend money on the cataract surgery, they just wanted to solve the cataract problem. But even so, they developed the expectation that after cataract surgery, they would be completely free from glasses for both near and far vision, that they wouldn't need to wear them anymore, and that their prescription would improve. This is an example of a lack of alignment, because by choosing a monofocal lens, especially a spherical monofocal lens, not the toric one that corrects astigmatism, it's very likely that some prescription will remain either for distance or for near vision, or to correct astigmatism, meaning the vision won't be perfect 100% without glasses. When we talk about cataract surgery, we try to correct the prescription at various distances to provide independence from glasses, but this depends on the person's eye health, whether they can receive a special lens, and also on economic factors, whether they want to or can invest in a more expensive lens that will provide these benefits. And finally, it's important to see if they actually achieve this result, even if everything during the surgery went perfectly to ensure they get this effect. But the lack of alignment between the doctor and the patient can be a common cause of frustration. And sometimes I have a patient who is nearsighted with about 3 diopters of myopia. He didn't want any kind of special lens, so I implanted a monofocal lens, but I programmed monovision and explained it to the patient. One eye will be good for distance vision. I'll try to get it as close to 0 as possible for distance. The other eye, I'll leave a little bit of prescription. I'll reduce your myopia, but I won't eliminate it completely because it will help you see up close. And she was dissatisfied after the surgery because I removed the 3 diopters of myopia she had, and those 3 diopters allowed her to read very well up close. So, after the surgery, her distance vision was great. She could drive and watch TV without glasses. She was left with 1.5 diopters of myopia, which helped her with larger print, but she didn't have that super sharp near vision without glasses, and that upset her. People with myopia really like their near vision, even though their distance vision is very poor. Even though I had talked and explained, this frustrated the patient after the surgery, something that happened with me as well, but it's really a lack of alignment. What we say isn't always understood in the best possible way. And sometimes it's only when the person is actually experiencing the situation that they truly understand. How did her vision turn out? Sometimes we even do a contact lens trial beforehand when we notice that the patient isn't really understanding the strategy we've chosen for them. So that's it. Sometimes the result you get with the lens that was implanted isn't what you were expecting from cataract surgery. That doesn't mean your surgery went wrong, okay? This just means that maybe you need glasses for distance or multifocal glasses or reading glasses. If your vision is 100% for distance and 100% for near, even if that means using glasses, we don't consider that a failure at all. Of course, it's frustrating, especially when you had the expectation that you'd be able to go without glasses. But this isn't a complication. It's nothing that can't be fixed. Third cause, this one is very common and easy to solve. You had cataract surgery, your vision turned out great, you were happy with the results. For months you were seeing really well, and then suddenly 6 months or a year after the surgery, or even less in some cases, your vision started to get blurry again. You said, it's not the same as those first weeks, not the same. That first month after I had just had the surgery and everything was clear, now it's kind of blurry. What happened? In cataract surgery, the lens is left inside an envelope. It's a transparent envelope called the lens capsule. It's like a plastic that wraps 360 degrees around the natural lens, which is the crystalline lens. What do we do in cataract surgery? Normally we open the front of the capsule. We make a circle called a capsulohexis. It's an opening in this transparent structure, this support that holds the crystalline lens. And then through this opening, we can break up and aspirate the pieces of the cataract, clean out the entire capsular bag. In the end, what's left is a structure more or less like this, open in the front and closed in the back, and we implant the lens inside here. The lens stays inside the capsular bag. This is the result we usually want in cataract surgery. The lens stays secure, it remains in that same spot because it's the capsular bag that's holding it in place. But what happens then? We open the front, but the posterior face of the capsule is transparent right after the surgery. So the light passes through the pupil, goes through the lens, passes through the transparent capsule, and reaches the retina with good quality. What happens over time? The posterior capsule also starts to become cloudy. It turns white. And the ray of light that passes through it starts to scatter too much. It reaches the back of the eye with worse quality. So this is easy to solve because you don't need another surgery. No. The doctor will dilate your pupil, will see that your capsule isn't completely transparent, and will schedule a procedure called YAG laser capsulotomy. This is a procedure we do in the office. It's quick, it doesn't hurt at all. And it's a laser that's applied to the posterior capsule, right? It's what people call cleaning the lens. But actually, they're not cleaning the lens. They're opening the posterior capsule. The lens remains held in place 360 degrees by the support, but now it has an opening in the front and an opening in the back for the light ray, so it can pass through and reach the back of the eye with quality. And it's not a procedure that you usually have to keep repeating, no. It's once in a lifetime. Once the posterior capsule is opened, the light ray will pass straight through the pupil, straight through the lens, and reach the retina with quality. And then your vision goes back to being that good vision. And usually capsulotomy, this procedure doesn't really change your prescription much. So if you've had cataract surgery and now you're noticing that your vision isn't 100%, it might be worth going back to your doctor to check if you've already had capsulotomy in both eyes or in the eye that's bothering you, because this is easy to fix, doesn't require surgery, doesn't hurt, and will improve your vision again. So this is the third most common cause of decreased vision, even after surgery. Another very common cause is my vision. It wasn't 100% after cataract surgery. And I don't know why, because I had that expectation. This also has to do with expectations and communication. But sometimes your surgery, your vision isn't 100% after cataract surgery because your eye isn't 100%. So there's no point in expecting cataract surgery to solve all your problems. Let me give you an example. A person who has amblyopia, what is that amblyopia? It's what patients call a lazy eye. So suddenly a person is born with no prescription at all in the right eye, but in the left eye, they're born with a higher prescription. And they didn't know about it. So during childhood, they didn't wear glasses, didn't use an eye patch, didn't do anything. The eye that didn't have a prescription developed 100%. It's great. It sees really well. Didn't have a prescription. I never wore glasses for it. The other one is really bad. Why is that? Because the brain didn't develop the vision in that eye. As a child, the brain couldn't merge the image from the right eye, which had no prescription, with the image from the left eye, which did have a prescription. So it suppressed one of the sides. It neglected the development of that eye and focused on the good eye. This also happens with strabismus. When a child has one straight eye and the other eye is misaligned, the brain pays attention to the straight eye and ignores the misaligned one. It suppresses the image from the misaligned eye, and then that eye doesn't develop. That's why we see children with an eye patch. We're patching the good eye to help the weaker eye develop as much as possible. And then in adulthood, the amblyopic eye starts to develop cataracts and vision begins to get even worse, even more so. And then you have to operate on the cataract. But sometimes the patient expects that if they have cataract surgery, their vision will return and become like the other eye, but it won't. So you operate on the cataract, you remove one of the problems, but the amblyopia is still there. With amblyopia, the eye didn't develop. It doesn't have 100% potential. So there's no point in thinking it will become like the other eye. In this case, you can perform cataract surgery and restore the level it had before. For that eye, that's its 100%, but it's not 100% compared to the other eye. And the vision still won't be 100%. The same thing happens if you have any after effects. Let's say you've already had retinal detachment surgery, you were left with some after effects, and then later you developed cataracts and had cataract surgery. It will get a little better, the light will enter more easily, the quality of your vision will improve, but it still won't be 100%. For a macular hole, for a macular disease like macular degeneration, for opacity, esnoconia, for keratoconus, we don't see just with a lens. Sometimes I get to the clinic and the patient says, "Doctor, my vision is bad. Can you give me a stronger prescription? Can you increase my prescription?" That's not it. It's not about increasing the prescription or putting in the right lens that will make the person see 100%, because we don't see with the lens, we see with our eyes. It's no use giving someone a very strong prescription. I have to give them the right prescription. So what happens is this: even after performing cataract surgery and putting in a good lens, usually in these eyes that have some kind of damage, we don't invest in or recommend a premium lens, a super special lens, because it's a high investment the patient would have to make and they wouldn't get the benefit of that premium lens. So usually we use a monofocal lens, a simpler, more affordable lens, because we know that the visual potential of that eye is not 100%. This is also a common reason for I had cataract surgery and my vision isn't good. And now let's move on to the fifth and more complex cause, which is when something didn't go according to plan. There may have been a surgical complication or some difficulty greater. When we talk about cataract surgery, it might seem like we're putting everything on the same level, but there are cataract surgeries that are easy and simple to resolve. The surgery is quick, the recovery is quick, or the surgeon, there was no trouble at all removing the cataract and placing the lens. And then there are special situations. When the anterior chamber is very shallow, in other words, the space we have to work in to remove the cataract is very small, when the person has corneal opacities, when the person has a very small pupil, when the person missed the ideal time to have cataract surgery and the cataract became very hard. All of these are factors that influence the difficulty of the surgery, and that's when complications can happen. And sometimes it's an eye that has already suffered trauma in the past and the patient doesn't even remember. In that case, the support isn't adequate. Sometimes the surgery is planned to place a special lens and some complication occurs. It happens during the surgery and the special lens can't be implanted. The doctor is forced to change the type of lens. Instead of placing a single piece lens, the doctor uses a 3-piece lens. And that's what's best for the patient. He switched to a simpler lens because that was the right thing to do at that moment. But this always leads to some frustration. So the patient who invested in a lens and had expectations of getting a certain lens experiences some complication during surgery and the type of lens has to be changed during the procedure. He ends up frustrated and later he can be psychologically affected by it, even when everything went perfectly. And when the vision is good. And sometimes even in situations where there are complications, sometimes there are no complications at all. Sometimes the surgery went really well, for example, with a toric lens, a lens that corrects astigmatism. It has a specific axis where it needs to be positioned. So let's say I operated on an eye, I have to set the lens at 90 degrees. It has a little mark and I have to align it at 90 degrees. And then in the post-operative period, it might rotate a little bit. This rotation of the lens can cause a negative effect on the prescription, and sometimes we need to reposition that lens. When the lens isn't centered inside the capsular bag, as I mentioned, when it ends up tilted for some reason after surgery, or when there's vitreous coming forward into the anterior chamber, these are all complications, reasons why even after cataract surgery, and it was a more difficult surgery or a surgery that was complicated, and that's why the vision isn't so good. In some cases, it can be treated just clinically with monitoring. In other cases, it will require a new procedure, either to reposition the lens or to remove the vitreous or even to replace the lens. Sometimes the lens just didn't turn out well to the point where we have to remove it, and there are other situations that can happen, like there was nothing at the time of the surgery, but you developed an eye disease, another eye disease over time. So you had cataract surgery, and after a while, you developed a membrane on the retina. There's a video about epiretinal membrane that I'll leave the link to here. You can also click on it, which explains it. A membrane formed on the retina, your vision started to get blurry. This has nothing to do with the cataract surgery. It was an ophthalmological disease that appeared later and also affects vision. The same goes if you have a retinal detachment years or months after the surgery, a macular hole, or if the cornea, which was transparent but not 100% healthy, starts to become cloudy after the surgery. Some patients even need transplants. What am I trying to say with this? That each case is individualized. There are simple issues that can be resolved quickly, either with a conversation, clinical treatment, or laser, but there are also more complex situations that will require more. A second procedure and sometimes even a third procedure. I perform a lot of surgeries, cases involving the fixation of intraocular lenses. I am a specialist in cataracts and also in retina, so I can handle situations, for example, when a patient there were no complications, his surgery was perfect, and suddenly the lens and the capsular complex dropped. Over time, without the patient experiencing any trauma, any blow, out of nowhere, because of a predisposition the patient had, a weakness in that support, everything just fell. So what do we have to do then? A vitrectomy, a second procedure to remove that lens that's in the vitreous and fix it, tie it down, since it can no longer be held by that support because the entire support has collapsed. So sometimes we need special sutures or special lenses that will secure and keep that lens in the right place so the patient can regain their vision. So that's it. There can be causes of decreased vision after cataract surgery. They're super easy to solve, super easy to explain or address, or to find an alternative to improve your quality of life. And there are also those causes where we will need a procedure, a second procedure to try to improve things. In some of these cases, depending on what happened, what the disease was, or what complication occurred, vision can recover 100% with the measures we take. In some other cases, there will be some lasting effects. It obviously depends on the severity. So if you're dealing with this kind of issue, seek out your doctor, seek help. You can send me messages here on YouTube, and I will, as much as possible and as much as I can respond without examining the patient, try to guide you about what might be happening or the best way for you to seek help. Don't forget to share this video with anyone you think might find it interesting. Don't forget to like and follow the channel here. and stay tuned for the next videos that I will always talking here about cataract surgeries and retina surgeries. A hug to all of you.